Hi guys, my name's Dan, I'm a veterinarian, and today we're going to cover the 5 most important things your veterinarian or a veterinarian will do to keep your doggy or kitty or whatever kind of pet you have safe under anesthesia. Now these are not in any particular order, but I'm going to go over 5 things that I think every veterinarian needs to keep the doggy or the kitty as safe as possible under anesthesia. Number 1 today, guys, is going to be an IV catheter. An intravenous catheter. This allows for the veterinarian to give maintenance fluids. It also allows for the veterinarian to give maybe a bolus of fluids if the doggy or the kitty cat is having problems under anesthesia. Also, we can give emergency medicine through that IV catheter and maybe antibiotics if needed. It allows for us to have this kind of safety valve, which allows us to give meds and fluids as needed to keep the doggy and the kitty as safe as possible during surgery. These next few, I'm going to jump towards monitoring. Monitoring is really important to make sure that there's no big changes as the animal's under anesthesia. The first one is going to be number 2 for me, which is going to be, I really like a pulse oximeter. A pulse ox is going to allow me to assess the oxygen saturation in the doggy or the kitty. Now, let's say we're not breathing. Let's say we have some sort of major cardiovascular or pulmonary issue during surgery. The pulse ox is going to drop, and that's going to indicate that we are not adequately oxygenating the doggy or the kitty. As well, it provides a heart rate as well, which is super helpful too. Right behind that, I like to have a CO2 monitor or carbon dioxide monitor. I just mentioned oxygen, now we're mentioning CO2. This is going to be a really good indicator really early on if there's a problem. When the doggy or the kitty cat breathes out, they breathe out the CO2. Some veterinarians may have a literal machine that kind of measures the CO2 as it comes out. Others may have some kind of contraption that beeps and alerts them if there's no CO2 being breathed out. Both of them are excellent and should be used because that allows us to identify if a patient is not breathing consistently or if at all, and allows us to give breath for the patient to keep them stable and oxygenated. Number 4 for me is I want to have an ECG. I want to see that PQRS move through the screen, and I want to know that the heart is fine. Sometimes you can get really abnormal heart rates and rhythms, and if I see it on the ECG, I can give my medication through the IV and stabilize my patient. So now I'm kind of balancing and using my ECG and my IV to provide the best quality of care for the patient who's under anesthesia. Rolling in at number 5, I really like to have a good blood pressure cuff. Blood pressure allows me to assess if the doggy's blood pressure is normal. If a doggy or kitty's blood pressure tanks or drops really low, I may use my IV again and give fluids. I may give emergency meds, or I may just adjust my general anesthesia. So having all these monitors allows for me to manage my patient under anesthesia. And guys, I didn't mention it, I'm throwing this on last because the most important thing for me is a skilled, licensed veterinary technician. They are amazing. These are the people that literally just stand there as I'm doing surgery and they monitor each machine. And they look at the patient and they look for, how well we're breathing, listen to the heart. They assess if there's any blink response. They are making sure the patient is at the appropriate anesthetic depth and that the surgery is going beautifully. Without them, we'd be lost. So this skilled veterinary licensed professional technician, sometimes called veterinary nurses, they will do all the managing and observing of the equipment with me, and if we need to do something, they're going to be my hands to give the medications IV. As always, guys, if this video has helped level up your pet knowledge and giving you more confidence regarding your pet's health, please like and subscribe. I would greatly appreciate it, and share it with a friend. You guys take care and have a great week. Bye.